joining us. Welcome, and we are happy that you are joining us. If you were in our previous session and there is a different session that you are wanting to attend, you just need to look at that program. Otherwise, we're happy to have you here as we are going to be addressing Alzheimer's and dementia. So I would like to, I think we still have a few students who are coming in. Is that correct?
Yeah, I might give it a minute or two more.
So we're gonna give it just about another minute or two to allow students who were in previous sessions to come on over to our session here. And then I will be introducing our presenter momentarily. So just give us a quick minute as we allow others to come in. So as you guys are coming in and we are waiting for everyone, if you wanna open up your chat really fast and maybe tell me, how did you guys enjoy the sessions so far, either our opening or general session, or your previous session of one of the concurrent sessions? Feel free to throw that inside the chat. I love Miss Chung's session too, very engaging, right? So we had some really great opening sessions, a very informative one, which is excellent. But the material, even though it's informative, can sometimes get heavy. So it was nice to have Ms. Chung follow and bring a little lighter side to it, correct? But very informative, great, good. We're really happy to hear that. We do have, we will have a survey at the very end and to present for you guys to give some feedback about the sessions that you have attended. So that's really good. Oh, motivational, yay, I like to hear that word. Very helpful and informational. I'm loving it. That's great. Okay, so we are at about 12:02. So this is our second and final concurrent section, our sessions that we are doing. So without further ado, I'm just going to go ahead and get the ball rolling because I want to respect the time that everyone has and our presenters' time. So without further ado, I would like to introduce our presenter. So first and foremost, welcome to our session on understanding Alzheimer's and dementia. Our presenter with us today is Ms. Cynthia McDermott, and she's the community educator volunteer with the Fresno's Alzheimer's Association. So just a brief description really fast about our session today. Alzheimer's is not normal aging. It's a disease of the brain that causes problems with memory, thinking, and behavior. So welcome for coming in today and joining us to learn more about the impact of Alzheimer's, the difference between Alzheimer's and dementia, Alzheimer's diseases, stages, and the risk factors, current research and treatments that are available to address some symptoms, and all about the Alzheimer's Association resources that are here in Fresno. So I'm going to go ahead and hand it over. Actually, a really fast reminder, if you do have questions, as our presenter is presenting, please do not hesitate to add those questions into the chat. And at the end of her presentation, we'll have a Q&A time. So I will be asking out those questions and allowing Ms. Cynthia McDermott to go ahead and answer as many of those questions that you guys may have. So without further ado, I'd like to hand it over to Cynthia and you can take it away.
Thank you, Paula. That was quite an introduction. I appreciate it. Hello, everyone. Welcome to Understanding Alzheimer's and Dementia, program presented by the Alzheimer's Association. My name is Cynthia McDermott, like Paula had mentioned, and I'm a volunteer community educator for the Northern California and Nevada Association chapter. Our office is located in Fresno, California, but is closed and currently 100% online due to COVID-19 restrictions. I'm a student at Fresno State working towards my bachelor's in psychology, and I just recently applied to graduate schools to do research on abnormal memory as well. My mother-in-law's mother was diagnosed with Alzheimer's when she was in the middle stage, so it was a pretty late diagnosis, and I got to see firsthand how the disease affects the person who has it, as well as the friends and family surrounding. But my great-grandmother also showed signs and symptoms of dementia before she passed and was never diagnosed. My grandmother tells me stories about things that my Gigi had said or did that confused her so much at the time, But now with her knowledge of dementia, it helps her to realize and reconcile those memories. This program that I'm about to give you is designed for people who are interested in learning more about Alzheimer's and other types of dementia. It will feature information from our dementia experts and perspective from individuals living with dementia and their care partners. Care partner is a term that we will use because it is preferred over the term caregiver while the individual who has Alzheimer's is in the earlier stages, when they may not need as much assistance with their daily tasks, but they may still benefit from the support of their family and friends. So before we start, I would like to learn a little bit more about everyone who's in our chat today. If you feel comfortable, I would like to know what brings you here. So you can enter your experience in the chat box and Paula can read them off at the end. If you have a personal connection to someone who is living with Alzheimer's or another dementia, if you are concerned about someone in your life who might be showing signs of dementia and you would like to learn more about this disease, or if you're thinking about a career in research or treatment of dementias like me. Thank you all for sharing. Periodically, I'll stop to ask if there are any questions, but like Paula had mentioned, we will also have time after the presentation for our Q&A. So today, we're going to take a look at Alzheimer's and dementia to give you a broader understanding of the disease. By the end of today's program, the goal is for you to be able to compare Alzheimer's and dementia, recognize how Alzheimer's disease affects the brain, list the known risk factors of Alzheimer's disease, identify the 3 stages of the disease, recognize current FDA-approved treatments that can address some symptoms of the disease, describe how scientists are working to advance our current research, and name the resources that are available to you through the Alzheimer's Association. Alzheimer's is a global crisis, and you are likely now hearing more and more about it in your everyday life. So we will first begin with what you know about the impact of Alzheimer's in the United States. You can write it in the chat so that Paula can read off some answers. How many Americans do you think are living with this disease today? We have any guesses?
First one is 12 million.
All right,
Anyone else? Oh, okay, now we're getting 3.4 million, a handful of 5.8 million, another
Good job,
12
you
million.
guys.
It's kind of all over the place.
All right. It's a big number.
Y es una cifra grande.
It's 5.8 million, somebody had guessed it. And without any further developments in prevention or treatment methods, this number is projected to reach 14 million by the year 2050. There's currently an estimated 50 million people worldwide living with dementia. All right, let's do the same thing with the next question. How many unpaid caregivers do you think are providing care in the United States for individuals who are living with Alzheimer's?
What do you guys think? Let's see,
Any
1.2
guesses?
million.
We got a 1.2.
Oh, a lot of people saying 1.2 million, 8.5 million, 1.2, 1.2, 13 million. Looks like
Yeah,
1.2
right,
kind of has
13.
the majority, but
All right.
8.5 million.
Well, you guys
8.5
would be
million.
surprised. Currently, there are 16.2 million Americans that are providing unpaid care for people with Alzheimer's or another dementia. Alzheimer's impacts caregivers constantly. More than 80% of care is provided at home by family members, friends, or other types of unpaid caregivers. And over half of caregivers who are simultaneously employed report having to go into work late, take time off, or quit altogether due to caregiver demands. Last year, these caregivers provided about 18.4 billion hours of care, which valued at more than $232 billion. This disease impacts the individuals facing it personally and financially. Now we can learn some of the stats that are about impact of Alzheimer's. Now I will play a video that might be quite sensitive as it shows the reality of this disease. If you would like to learn more, you can visit alz.org/facts. You may sometimes hear people use the terms Alzheimer's and dementia interchangeably. Although this vocabulary is related, they are different. In the next section, we are going to discuss both Alzheimer's and other dementias and how they are related. Before we begin, let's take another moment to test your knowledge about Alzheimer's disease. So enter in the chat if you think that this is true. Alzheimer's is a normal part of the aging process. It's a little pop quiz from what Paula had said in the beginning.
Getting lots of falses.
Good.
False,
Nice.
false, false.
Wonderful. Alzheimer's disease is more than just memory loss. It is a progressive and fatal disease that kills nerve cells and tissue in the brain that affects an individual's ability to remember, think, plan, and ultimately function. Let's try another question. Enter in the chat if you believe this is true. People younger than 65 can develop Alzheimer's.
Looking like a lot of truths.
All right, you guys know your
any
stuff.
falses, just all true.
Good. Approximately 200,000 Americans younger than 65 are living with early onset Alzheimer's. In some cases, people develop the disease in their 40s or 50s. Now, here's a video from one of our experts, Dr. Heather Snyder, explaining how Alzheimer's and dementia are related.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow in the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual, but there is also some overlap in behaviors among the types of dementia.
There are many causes of dementia other than Alzheimer's. However, between 60 and 80% of all dementia cases are caused by Alzheimer's disease. There are many types of dementia. Each one has different causes and symptoms. The ones that were listed are just a few classifications. There are many causes of dementia, and a diagnosis of dementia requires further testing to identify the specific disease that is causing the symptoms. It is important to seek an accurate and early diagnosis. Here's our care partner, Gail, who will tell us about the importance of knowing her husband's diagnosis.
Certainly, having the diagnosis of Lewy body was helpful in our planning because we began to understand where this was coming from in the brain, where otherwise we would not have known. Like we knew something was happening, but what was it? To give it a label actually helped, although it was a big umbrella. It explains some of the characteristics and symptoms that we were experiencing and seeing.
While there is not yet a treatment that can slow or stop the disease, there is value in seeking an accurate diagnosis so that you know what to expect. So far, we have discussed that dementia is a general term for a collection of symptoms that are severe enough to interfere with a person's daily life. Alzheimer's is the most common type of dementia, and Alzheimer's is not a normal part of aging. It is a progressive brain disease. Next, we will look at what goes on within the brain when Alzheimer's disease is present. As we have discussed, Alzheimer's is a brain disease. The brain is the most intricate organ in the human body, despite weighing only about 3 pounds. We will hear from one of our experts about how Alzheimer's affects the brain.
More than 100 years ago, Dr. Alois Alzheimer's described specific changes in the brain, what we call the formation of plaques and tangles. Now, Alzheimer's is a progressive brain disease that's marked by these key changes and is thought to impact memory, thinking, and behavior. The brain has 3 main parts: the cerebrum, the cerebellum, and the brainstem. Each one plays a role in how the body functions. The cerebrum fills up most of your skull. It is part of the brain most involved in remembering, problem solving, thinking, and even feelings. There are about 100 billion nerve cells or neurons throughout the brain that transmit messages in order for us to create memories, feelings, and thoughts. Alzheimer's disease causes nerve cells to die, which leads to the brain tissue loss, or what we call shrinkage, and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's disease, such as memory loss, problems with thinking, planning, behavioral issues, and even at the end stages, problems with swallowing.
Over 100 years ago, Dr. Alois Alzheimer described changes in the brain that he called the formation of plaques and tangles. This disease causes nerve cells to die, which leads to shrinkage of the brain. This change is followed by changes in memory, thinking, and behavior. Everyone is at risk of developing Alzheimer's disease. There are few known risk factors that increase the chance of a person developing Alzheimer's. Let's see if you know which risk factor is the most common. Enter it in the chat if you think that the greatest known risk factor for Alzheimer's is genetics, family history, or age.
First answer out of the chute is genetics, and a lot of genetics.
Okay.
Everyone's saying genetics, genetics. Still getting genetics.
Wow.
Looks like everybody's saying genetics.
All right.
Well, we got one age and a couple family history.
There we go.
So a little bit of variation
there.
A
little variation. Good. All right. So as mentioned, these are all known to be risk factors, but age is our greatest known risk. Let's hear a little bit from one of our experts about these risk factors.
Alzheimer's disease is marked by specific brain changes that result in the clinical changes in individual experiences. That is, changes in memory, thinking, or reasoning. And ultimately, Alzheimer's is fatal. The exact cause for these changes is unknown, but there are some hints as to what may contribute to an individual's risk. Age is the greatest known risk factor for Alzheimer's. And when we look at populations of people, we see an increased risk over the age of 65. However, Alzheimer's is not normal aging. Family history is also a known risk factor. Research has shown that those who have a parent or a sibling with Alzheimer's are more likely to develop the disease, and that risk increases if more than one family member has Alzheimer's. When we talk about the genes involved in Alzheimer's, there are two categories that could potentially be involved: risk genes and deterministic genes. Risk genes increases an individual's risk for developing the disease, but does not guarantee that they will develop Alzheimer's. Deterministic genes, which are rare for Alzheimer's, guarantee that the person will develop the disease.
Alzheimer's and other dementias are not a normal part of aging, but increasing age is the greatest known risk factor. Let's look at some populations of people who are at a higher risk for developing the disease. In addition to the main risk factors like aging to the general population, Hispanics, African Americans, and women are at a higher risk for Alzheimer's. Research has shown that older Hispanics are about 1.5 times more likely than older whites to develop Alzheimer's and other dementias, and African Americans are twice as likely. The reason for the differences of risk within different ethnicities is not well understood, but researchers believe that the higher rates of vascular disease in these groups may be what puts them at a higher risk for developing the disease. We know that women are more likely to develop the disease than men. Currently, it is believed that 3.4 million American women are living with this disease. This is believed to be because they live longer than men, which makes them more likely to develop Alzheimer's. Alzheimer's disease is the failure of nerve cells, the exact cause of which is still uncertain. Research has identified risk factors that may increase the likelihood of developing Alzheimer's. Currently, age is the greatest known risk for disease, and an individual's risk for developing it increases at the age of 65. Family history is another known risk factor, and having a parent or sibling with the disease increases a person's risk. And Hispanics, African Americans, and women are all at an increased risk. Before I move on, were there any questions about the stages of this disease? Anything pressing before Q&A?
I do not see anything in the chat as of yet.
All
So
right.
I will let you know if we do.
Sounds good. Thank you, Paula.
You're welcome.
This disease is not the same for any two people. The symptoms and progression are different for each individual. Let us hear from another one of our experts, Dr. James Hendricks, on why there is this difference, as well as from some individuals describing what it is like to live in the early stages of Alzheimer's disease.
One of the things that impacts our brain is all the other things that can happen to us as we age. And we know that Alzheimer's, the most common risk factor for getting Alzheimer's disease is age. But we also have lots of other things that go wrong with us as we age. And so how those other health factors
Los
impact our
factores de riesgo afectan.
Alzheimer's presents in other people.
Math, I can't do a simple tip anymore. You know, I sit there, I stare at it. It's crazy what numbers I can't deal with anymore. And in some ways, that's the disease to me. The other thing that I've increasingly been struggling with are words, which I've dealt with words my entire life. You know, as an avid reader, as a reporter, as a writer. I struggle with them now.
I'm like an overachiever. And when you're unable to deliver or you're not performing at the same pace that you once did before, that's frustrating. It's frustrating to not know where you place things. It's frustrating to not be able to explain to someone the problems that you're having. You can't articulate it in a way. It's frustrating to read something and you forgot what you read. It's frustrating to continuously have to change your password and you just changed it last week and you're constantly doing the same thing over and over again.
I think the thing that surprises me the most about my dementia is that it is progressive. And I'm finding that I'm forgetting more. And they do memory tests for me all the time at the doctor's. And so that becomes a little disconcerting at times, to see my cognitive impairment continue to decline. But again, I really have hope. I don't live really in the future. I can't live in the future. I can't worry about what the future is going to bring. I have to live for today.
The individuals we just heard from are living in the early stage of the disease. These symptoms worsen over time for everyone, but people progress through these stages of Alzheimer's at different rates as their abilities change. On average, a person who has Alzheimer's lives 4 to 8 years after their diagnosis, but can live as long as 20 years with the disease, depending on other life factors. Now here's Dr. Snyder again, explaining the 3 general stages of Alzheimer's disease.
Alzheimer's affects everyone differently. As a result, it's difficult to place a person in a specific stage of the disease. However, there are 3 general stages that are commonly referred to as early, middle, and late stage Alzheimer's. In a medical context, you may hear these stages referred to as mild, moderate, and severe. In the early stage of Alzheimer's, an individual may be able to function independently. However, they may start noticing more frequent memory lapses. Friends and family may also begin to notice difficulties in the person, and a healthcare provider may be able to detect problems in memory or concentration by conducting a detailed medical interview. Middle stage Alzheimer's is typically the longest stage and can last for many years. Damage to the brain cells can make it difficult to express thoughts and perform routine tasks, and this can lead to increased feelings of frustration and anger. In the final stage of the disease, an individual loses the ability to hold a conversation, control their movements, or respond to the environment around them. Cognitive skills, that is their memory, thinking, and reasoning skills, continue to decline, and this can lead to personality changes and need for round-the-clock care.
As it was previously said, it is important to remember that the stages of Alzheimer's are general, and because each person living with the disease has a different and unique experience, we cannot always neatly place an individual into one specific stage. And some people may show symptoms that overlap stages, but the stages do allow you to generally understand the progression of the disease. As Alzheimer's progresses, the person's behaviors will begin to change, as does the role of a caregiver. These stages can help the caregivers to prepare for what they can expect and how they may respond.
You do have one question that came through on the chat. Would you like me to ask that?
Sure.
So it does ask, Yang asked, would nerve cells be defective or mutated when resulting from Alzheimer's disease?
So as far as I know personally, they do not, but I will be giving a phone number at the end of the presentation that actually has experts, medical doctors and psychologists who can answer any question, and they're available 24/7. They're pretty great at literally answering any question anybody has as well. But I do also have another Alzheimer's Association member who will be helping me to answer questions at the end as well.
Excellent. And there's a few more questions coming in. Would you like to continue with your presentation and then go to questions? Would you like me to ask them?
Yeah, let's give it a few more. I have another spot where I'll stop to ask for questions as well.
Perfect.
Thank you, Paula. I
No
appreciate
problem.
it. So the 3 stages of Alzheimer's disease, early, middle, and late, are generally called mild, moderate, and severe within the medical context. There is no 2 individual experiences where the symptoms and progression of Alzheimer's are the same. While the symptoms will worsen over time, each person progresses through stages at different rates as their abilities change. We should see what you already know about treatments that are currently available for the Alzheimer's disease. So enter in the chat box if you believe this to be true. There are several drugs available to slow down the progression of Alzheimer's disease.
Lots of truths coming through.
Okay.
I got a true with a question mark. There's
Good
a
to be
false
right. Okay.
and more truths.
All right. So it
false.
sounds like we are mostly saying true, correct?
That is correct.
All right. So there are currently no drugs available to prevent, treat, or slow Alzheimer's disease. However, there are several drugs available to address some of the symptoms that come along with the disease. Let's hear from Dr. Hendricks about some of these medications that can help with the symptoms.
There are currently several drugs that are FDA approved to treat the cognitive symptoms associated with Alzheimer's disease. They treat the symptoms, but they don't treat the underlying cause. So eventually people will progress, but they do treat some of the symptoms and help people for a time. So the first class of drugs are cholinesterase inhibitors. These drugs work to prevent the breakdown of acetylcholine, which is a chemical messenger found in the brain that's associated with learning and memory. There are 3 FDA-approved drugs that are in this class of drugs. There's Aricept, there's Exelon, and there's Razidine. There's another class of drugs that modulates glutamate, which is another chemical messenger in the brain that's associated with learning and memory. And this drug is called Namenda. And then there's a final class, which is actually a combination of cholinesterase inhibitors and glutamate modulator, and this is called Namzaric.
Although small, the brain is extraordinary, and there's still so much we don't know about it. And like Dr. Hendricks mentioned, these treatments can help to relieve some symptoms in people for a time, but because everyone experiences Alzheimer's differently, these treatments work in varying degrees and are not effective for every person. An accurate diagnosis is important to make sure that the proper treatment can be prescribed because drug misuse can lead to more negative side effects. So now we can review. There are 3 types of drugs approved to help manage the symptoms associated with Alzheimer's disease. The first type are cholinesterase inhibitors. The second are glutamate modulars, and sometimes a combination of both are used, like Namzaric. These treatments are only address some symptoms of Alzheimer's in some people, and they do not treat the underlying cause of the disease. Within the last decade, researchers have made enormous strides in understanding how Alzheimer's disease affects the brain, and recent insights have pointed towards promising new strategies for eventual treatment, prevention, and diagnosis.
This is an incredibly exciting time in Alzheimer's and dementia research. The advancements that we've made in the last decade to understand the disease is a continuum, meaning that the biological changes are starting a decade or more before someone is experiencing the changes in the memory and thinking. This sets the stage for possible prevention. The idea that when we have the tools to identify those individuals at the earliest time point, and when we have the interventions to target individuals at that earliest time point, we can intervene to stop or slow the progression of the disease before an individual loses their memories.
I'm excited about what we're learning these days regarding lifestyle. One of those things that we've seen in the past of things like exercise and nutrition have now started to gain more momentum to indicate to us that it can change your ability to slow cognitive decline. That is really the first stages of Alzheimer's disease. This may include things like social engagement, mental cognitive training. It can be things such as exercise. It can be nutrition. All those things are now starting to point that they will lower your risk for Alzheimer's disease.
A lot of hope does come from the Alzheimer's Association, all the research that is being done. Even though there is not a cure today for the disease, I know in my heart there is going to be a cure one day, and I know we're getting closer for that cure. Because even if you fail in a research study, you learn from that failure in the research study. That failure always brings progression.
It's nice to see the association spearheading in many ways the emphasis on getting the money at the federal level and at the private sector to get the research done so that someday there will be an effective treatment, hopefully cure, hopefully prevention.
If there's one word that we hear a lot in the Alzheimer's Association, it is hope. There's a lot of hope for where we are headed with Alzheimer's and other dementia research. One of the key ways to keep research moving in the right direction is through clinical studies. Scientists are constantly looking for new ways to treat Alzheimer's, and there are many drugs currently in the research pipeline. Recruiting and retaining trial participants is our greatest current obstacle other than funding to develop the next generation of treatments. Let's hear from Drs. Fargo and Hendricks about these clinical studies and how you can become involved.
It's more important than ever for people to participate in clinical studies. The fact is, right now, we don't have an effective treatment to stop Alzheimer's disease. And if we don't have people participating in clinical trials, we never will. And so participating in a clinical study is one way that everyone can get involved in a very direct way in the fight against Alzheimer's disease. And for people who currently have dementia or Alzheimer's disease, there are some additional benefits. You get access to very close medical care. You also may be among the first people to have access to the treatments that will eventually prove to work.
Sometimes you hear the phrase, it's a failed trial. That means that it didn't hit the endpoint, it didn't achieve an FDA-approved drug. But I would say as a scientist, the only failed trial is one that doesn't give you valuable information. And if the trial is well designed, if it is a good scientific experiment, you get extremely valuable data so that you can plan the next trial and do the next study even better than the last one. And it gets you that much closer to that FDA-approved drug, to that effective treatment and maybe someday even a cure.
As we heard, everyone can be of help to advance Alzheimer's research. It is especially important that people of diverse backgrounds are participating in our clinical studies, since they are at an increased risk of developing the disease. It is important that our researchers are able to study large populations of these individuals to better understand the disease and their elevated vulnerability. Let's look at how the association can help you find these studies.
Currently, more than 5 million Americans are living with Alzheimer's. By participating in clinical research, you can move us toward methods of treatment and prevention for all those affected by this devastating disease. Alzheimer's Association Trial Match is a free clinical studies matching service for those with dementia, caregivers, and healthy volunteers. To start, simply create a confidential user profile and receive a list of studies that may be a match for you. Don't just hope for a cure, help us find one.
I recently got to do a roundtable with some of our experts and some of the people that you've seen in this program. And the one thing that they kept drilling into us was how important clinical studies and getting people to use Trial Match was. Are there any questions specifically about clinical studies or Trial Match as of right now?
Nothing's coming through just yet that are specific to Trial Match as of right now.
Good. All right. Well, we're almost to the Q&A portion for the rest as well.
Perfect.
As an overview, scientists have increased their understanding of Alzheimer's significantly over the last 10 years. People with this disease, their caregivers, and healthy individuals without dementia are needed to participate in clinical studies in order to find methods of prevention, treatment, and ultimately, hopefully, a cure. Both drug and non-drug studies are taking place across the country and online. Clinical studies may provide participants with new, cutting-edge treatments and additional medical care. The Trial Match is a way to help people who are interested in participating in Alzheimer's research find free clinical studies. Alzheimer's disease is difficult, but no one has to face this disease alone. Let's now learn more about the Alzheimer's Association and how we are here to help individuals and families across the country. The Alzheimer's Association is in communities across the country where they are providing direct service to individuals and families that are facing this disease. Our mission is to eliminate Alzheimer's disease through the advancement and research to provide and enhance care and support for all of the affected, and to reduce the risk of dementia through the promotion of early brain health. Our vision is a world without Alzheimer's disease. The association is available wherever and whenever you need reliable information and support. We have 3 key resources that can connect you to information and support. These are, firstly, our 24/7 helpline, as I had mentioned. You can call us anytime at 800-272-3900 to receive information and support. On the other side of this number are highly trained and knowledgeable staff who can help with education, decision-making support, crisis assistance, and resource identification. These master's level clinicians are available around the clock to provide in-depth care consultations, a free of charge care navigation service offered to families who are at any stage of the disease. And the helpline is available in more than 200 languages. Here's Tim, a care partner who has called our helpline for support in the past.
I've had a couple of phone calls that I've been able to make in to the call center when I've had a couple of quick questions that I wanted to ask. You know, there's been a couple of nights, 2 o'clock in the morning, you have questions, you have anxieties, and I was struggling dealing with them, and it's amazing. It was one of the best things I ever did, was keeping the call center on my favorites now. Just to know that there's somebody you can call who is aware of what you're going through.
Another resource is our website, alz.org, which is usually the first stop for individuals following an Alzheimer's or other dementia diagnosis. And it includes sections that are specifically for people living with the disease and for caregivers. Here's Teresa, who is currently living with Alzheimer's, and what questions she had and what information she was able to find at alz.org.
When I went to the Alzheimer's Association website, which is alz.org, there I was trying to find out more about what was Alzheimer's, what really is this disease, what is younger onset Alzheimer's, what is dementia, is there a cure, how long has this been around, how many people are affected by this, where can I go for resources, where can I go for help, what do I do with this? How can I handle this? Is there more people like me out there? Is there someone that I can talk to if I need to? And there I found the support line that's 24 hours a day. And there I found where I can go for workshops, where I can go and read things and postings that people have done, where I can find out what events is happening in the Alzheimer's Association, where I can see how it's affecting people around the globe.
And the third is our community resource finder. A lot of community-based resources may be available in your area, including long-term care and community services, as well as association offices and their offering of programs and support services. To find this, you can visit alz.org/crf. Tom, who is also living with Alzheimer's, shares his experience of seeking help in his area by using the resource finder.
Since I've been diagnosed with dementia, the one place that I know I can go to for assistance and help and support is to the Alzheimer's Association. There are people there that I know by name that I can contact if I'm having a difficult time or if I'm struggling to find some resource, that they will provide that to me.
Here are some ways that you can join the fight. You can volunteer. The Alzheimer's Association is always looking for volunteers like me to give a few hours a week of their time to become a community educator, join a local walk planning committee, or become a support group facilitator. All of these volunteer descriptions and more information can be found at alz.org/volunteer. You can also become a part of the Alzheimer's Association advocacy team, who is busy advocating for public policies that increase our critical research funding and support our local, state, and federal levels. Learn more about what our advocates are working on at alzimpact.org. As mentioned before, everyone is able to help with Alzheimer's research by participating in clinical studies, trials, and you can become involved at alz.org/trialmatch. And lastly, one of the largest fundraisers worldwide is our Walk to End Alzheimer's, and you can register to help raise awareness at alz.org/walk. All right, that concludes our program of Understanding Alzheimer's and Dementia. Now we can do our Q&A.
Thank you so much, Cynthia, for all of that amazing information. I'm going back up to the previous questions that we had listed. And then I just want to encourage students as we're asking these out, please feel free to continue adding any additional questions that you have in the chat while we have the opportunity to ask them. So this has kind of been addressed or a little bit addressed, but there is a question about, are there ways to prevent Alzheimer's disease?
So as of right now, we do not see any research leading to prevention, but what we do promote is early brain health. So doing things like staying active, preventing heart or keeping your heart health, and staying active in, the use it or lose it. If you don't use your brain, if you don't challenge yourself, then you could lose that ability.
Excellent. Thank you so much. How should someone approach care for a dementia patient?
Yeah. So we actually have a lot of more programs on our website that go through specifically how to speak to people who have dementia and how to care for people who have dementia. So a lot of caregiver support and just more information on how to actually interact with people who have dementia, and tough conversations that may be had. Things like taking away keys. When is it time to stop driving? When is it time to have a live-in care support or put somebody in a facility so that they are more safe? You can find all of those at our website, alz.org, for more programs like this one that can give more information.
Excellent. Sounds like the website is the place to go for information, which is great. Another question, at what stage is dementia normally diagnosed?
So usually it's diagnosed in about the middle stage. So this is because if a person is living alone, you may not see, like if you don't live with your grandmother, then you don't see the changes in her behavior or her actions. So you may not notice until her behaviors become very erratic or very out of the usual or normal for her. So it's usually about middle stage, which is something that we're trying to promote early diagnosis.
Excellent. Thank you so much. Here's a good question. Is portrayal of Alzheimer's in the movies accurate?
So that is hard to say. For what I like to say about movies for any type of mental illness or Alzheimer's and dementia is that it is very exaggerated because a person who watches a movie needs to be able to understand that there is something happening. So I would say any type of movie or things like that is very exaggerated. But there are changes that happen. There are behavioral changes. People get irritable and frustrated because they can't remember things, because they can't express their needs or wants. What I recommend everyone to do is volunteer at a local association, volunteer at the Alzheimer's Association, or like what I started out doing is I volunteered at Oasis, which is an adult day program for people who have dementia. It's basically caregiver respite so that they drop off their loved ones for the day while they go to work or while they run errands or do anything that's important outside of being a caregiver. And so then you get to be hands-on with people who are suffering from this disease and see what they are going through and who they are becoming.
And definitely volunteering gives you a new perspective as opposed to what you can just see on TV. So definitely. Good advice, very good advice. Someone has asked, Crystal is asking, can someone develop Parkinson's along with Alzheimer's?
So a Parkinson's disease diagnosis, Parkinson's in the later stages actually becomes dementia. So a person who has Parkinson's is, I don't want to say 100% because I'm not an expert. I know that they are a very high percentage of developing dementia later on, and that they're correlated.
Yes, thank you for that. That is a good question. How can we tell the difference between normal changes that come with aging versus changes that may be signs of dementia?
Definitely. So one other program that we offer is called the 10 warning signs of Alzheimer's and dementia. And that really helps people to differentiate, because something like losing your keys, I lose my keys and I'm in my 20s, right? Like I don't know where I put them, things like that. That's normal. Something like forgetting your childhood home, or something more recent, forgetting what day it was yesterday, or something that you forgetting to bathe, forgetting to take care of yourself, forgetting to take your medication regularly. There are lots of, it's more severe than regular forgetting. It's not, oh, I don't remember so-and-so's name. It's, I forgot my daughter's name, or, more severe cases like that. But yeah, the 10 warning signs of Alzheimer's and dementia is a really great program for you to take if you're interested in things like that.
Definitely good answer to that. We have another question asking about how long does the disease take to develop before you begin to see warning signs?
So something like that is different for every person. No one's diagnosis, nobody's disease is the same. It's the same as somebody who gets the flu. Your flu is not going to be the same as somebody else's. So it very much depends on the person, and your physician, your doctor can help you to navigate those changes.
So that brings us to the end of the current questions, which is actually pretty good on timing because it's 12:50. So nicely done there, perfect timing. Is there any other questions, last minute questions that anybody has for Miss Cynthia before we wrap up? Just give a minute or so.
No problem.
Half a minute.
That's why we're here.
Yeah. So if there are any questions, you can add another one to the chat. But I would like to take this opportunity to just say thank you so very much, Cynthia, for coming and presenting this, critical information that is needed. I can say honestly that I learned something new. I didn't realize it was the 6th leading cause of death in the U.S. And so that's it's heartbreaking, but it's informative at the same time. So it's good to know the signs and the symptoms. If you can see the chat, you can start to see all the thank yous that are coming through to you for your presentation today. And hopefully students are going to be leaving with something that they can take away from it. So I would like to just say, as we are wrapping up, because it looks like we're getting just a ton of thank yous. Thank you so much for presenting. We truly appreciate it. So wrapping up the session, I just would like to take this moment really fast to say thank you so much to everybody who has attended today. I am dropping in the chat right now a survey link that we would really like for you guys to go ahead and do and take that survey for us to let us know how today has gone for you so far. We do hope that you learned something useful that you can use and that you can apply to your life today or on your journey in becoming a health professional. The survey link, I did drop that survey link. It looks like myself and Miss McKenna, we're thinking the same thing at the same time. So it's in there twice. So you can click on the survey link there. Please take a moment to provide us some feedback about your experience today. We will be drawing 5 names for some $10 Target gift cards for those who participate in the survey. So we really appreciate you doing that. And I would like to announce that we are doing a bonus session today at 1:15. This is about the current COVID vaccine. So I know that we've had a long day online already, but I would really like to encourage each and every one of you to come back and join us for this final session. It is about, again, like I said, the COVID vaccine. What is it that you need to know? And they're going to provide information and allow for questions regarding the vaccine. So if you've had questions about all the information that's kind of been thrown out there for you, this is a great session to attend because we'll have an expert panel or an expert presenters that will come in and can talk to you guys about answering those questions, explain more about the vaccine, give you information that's important, and just, again, answer any of those questions that you might have. So for right now, I believe that is everything. Again, Cynthia, I just would like to say one more huge thank you for coming in and presenting about this just really important topic, and for all the work that the Alzheimer's Association here in Fresno does to just advance the research on this disease, as well as to provide support for those who either have the disease or those who are caring for those that do. So thank you again for coming and presenting. We truly appreciate
Thank you for having me. I
that you
really
do.
appreciate it. Thank you.
Absolutely. You're welcome. Miss McKenna, is there any additional thing that you would like to add as we are wrapping up this particular session?
We highly encourage everyone to attend the COVID vaccine webinar. I'm actually going to drop into the chat the link to the program as well if you need navigating to that. But I think if our presenters have presented everything, that's all we have for today.
And just one last reminder, it'll start at 1:15, so it gives you about a 10 or 15-minute break to go use the restroom, grab a quick drink or a small snack, and meet us back here for the vaccine webinar. And then we will wrap up our afternoon and allow you guys to enjoy the remainder of your weekend. So don't forget to do that survey. Thank you so much. Bye, everybody.
We'll give everyone some time to. I'm going to start putting everyone else in the waiting room unless they're on our team. They're going to be in the next presentation.
I don't see the presenter yet. Do you? No, huh?
Not yet.
Okay.
If my co-host could help me with pushing people into the waiting room, that would be wonderful.
Sure.
Thanks, Stephanie.
Oh, I'm not going to put the interpreters. Okay. Hopefully I don't send anybody that I'm not supposed to. Oh, because everything's changing. Let's see. I think I got everybody now.
Yeah, I think we should begin.
And McKenna, you have to stop recording, right?